Hi, it's Jenny B, NSWOC, back with some more in our infection series, part of the I in time. And today I want to talk about the 5 different types of antimicrobials that are available on the market. There are a couple others that roam out there, but these are the ones that we probably see the most often that I just want to expand a little bit on. So number 1, I'm going to start with silvers. So silver has actually been used in wound care since the time of Aristotle. We actually tried to use gold for a while, but they came up with that it was a little bit too expensive, so we went back to the use of silver. It's great because it will kill, as an antimicrobial, bacteria, viruses, and fungus. So it's got many uses. I've seen it in a textile, which is Interdry AG, which can be used for intertrigo or skin fold management. It's available in non-adherent contact layers. It's also available in gelling dressings, hydrofibers, and both combination hydrofiber and alginate, as well as just plain alginate. So it actually comes in a lot of varieties, but the components are pretty much the same in all of them. Just the silver might be used for a different purpose. I often will actually see them too in a charcoal dressings, because silver is actually very effective against odor. So we've used it, as I said, for many years. There is stewardship that we try to keep with our antimicrobials, just like we do with antibiotics, that we don't want to use them for weeks and weeks, and we also don't want to be using them just to prevent infection, because for the most part they don't. They're there to help when there is active critical colonization. Now, I did discuss colonization back in Nerds and Stones, and when we're seeing that there are signs of infection developing, that's actually when we want to be using our antimicrobials. That's what the best point of contact is, to put them before they actually are requiring antibiotics. So silvers again come in a metallic based, which are majority of silvers. They're metallic based, and then there is a few available in a crystalline form. That's mainly in your Acticoat silvers. So the crystalline silvers, they actually require activation or cleansing with sterile water versus the salt water, because it can change the composition of the way it's deposited. So because you'll hear there's lots of different research, oh well, it's silver, I have to use sterile water. It's really only with the crystalline based ones. All the metallic based silvers are fine to have use of normal saline, to note. So again, there's multiple hydrofibers and alginates and combinations available in gelling dressings. And I will say that when I talk about a little bit more about the diabetic foot ulcer, that honestly, when we're maintaining or we have something very chronic, we will continue to use those maybe beyond the 4 weeks that our antimicrobial stewardship kind of denotes, especially if, again, we're not able to address some of the other underlying causes or treat things like blood sugars, offloading, and whatnot. So it is one of those ones that, again, it has that dull, yeah, sometimes I can continue to use it for beyond that 4 weeks, but for the most part we want to be stopping these when we're no longer seeing any signs of colonization locally. So again, Acticoat's one of the crystalline, and pretty much all the other ones have a metallic base. So second up, I want to talk a little bit about iodine-based products. So if you've seen any of my other videos, you'll hear me rant on about how iodine is one of the smallest molecules, and it penetrates bacteria a little bit better than some of the other products. But for the way that it's available, we're often looking at a wound that's a little drier. So when we're using betadine or iodine-based tinctures, we are using those to dry out a wound, especially something that has some peripheral vascular disease, or we're trying to maintain an eschar. The betadine will create a crust and help to dry that out. So again, it's not something that's in a heavily exudating wound that we're using a lot of iodine-based products. The other time is when we're using condexamer iodine or an iodine paste, which is an autolytic debriding agent, which helps to get rid of slough within a wound. So again, that's when it's a little drier wound, not heavily exudating, but we're using it for a primary purpose of debridement. And again, then Inidine is a great product that is a non-adherent. It's basically adaptic that has iodine impregnated into it. So it's giving an antimicrobial but well as a non-adherent properties. So when something that we're just maintaining the moisture with, Inidine is a great product that we're going to consider for use. And often, as I said, when in doubt, put Inidine on it, because you really can't mess it up too badly. And it's super cheap. The next one I want to talk about is chlorhexidine-based products. So chlorhexidine can be cytotoxic when you overuse or use for long periods of time, but when we're using 2% or less, for the most part, we can be using that product quite safely. Bactigras is chlorhexidine-based non-adherent with some petrolatum or petroleum jelly that does provide some moisture maintenance. That is a chlorhexidine-based product that is used for multi-purpose as well, and usually when you're for incision lines and lots of other burns and things that just need that little bit of moisture but not too much. I also tried to put AMD in this category as well, or PBMH, because it is a large molecule chlorhexidine-based product. AMD also doesn't donate a lot of product into it. It actually just kind of sits in it. So it's to be aware that you're not actually putting a lot of chlorhexidine type chemicals into the wound, but again, it will allow for the gauze to maintain for up to 3 days. So that's one of the reasons we are using it. Curlex is part of that AMD family, but it's a much larger version that we can use when we're packing into really large wounds. That is quite effective at maintaining, and it does help somewhat with odor, but not as much as perhaps a silver. So again, you got to look at some of your patient-based concerns as to why you're choosing one product versus another. One of the others is Hydrofera, which is a polyvinyl alcohol foam that's impregnated with this methylene blue, which is the actual product category. This is a product that does offer some antimicrobial action if a lot of other products haven't worked, but again, it's for one of those wounds that is a little higher exudating, because you do have to actually pre-moisten this product prior to putting in the wound. So it will dry out if you're already in a dry wound, but in a heavily exudating wound, it's sometimes a good choice, because not that it has absorptive properties, but that it helps with that, to maintain that moisture balance at the wound site. So again, it comes in multiple forms. There's tunnel packing, there's rings for around an ostomy, as well as foam pieces that you can put on almost any type of ulcer. But again, be careful, because it can be non-selective with debridement, and make sure you do pre-moisten it when you remove it, so that we're not removing good tissue as well as some of the bad tissue that we're trying to remove. And lastly is honey. Honey is actually an antibactericidal, so it's still in the antimicrobial family because it does kill bacteria, but it's not as effective on viruses or fungus. What honey is really great at is burns. Why? Because all burns need moisture. And honey, because it is already a moist product, putting it in a highly exudating wound, or one that you're trying to remove moisture from, sometimes it isn't a great product, because it's just going to add more moisture and make maceration occur. So it is one of those products, again, I love using it especially for kids with burns. It actually helps to reduce scarring. It makes it very minimal. But again, make sure you consider that, again, because it is honey, and it literally is, it's just from a specific tree, that it will, the moisture from it can actually add that into the wound. And if it's not the type of wound that you want to be adding moisture, that it might not be the right product. Anyways, that's my blurb on the 5 different types of antimicrobials. Hopefully you found it helpful for use in your practice, and I'll see you in the next video.